everyone! Welcome to the video on interacting with children with autism spectrum disorder in the healthcare setting. There is increased all-cause hospital contact for children with autism spectrum disorder compared to neurotypical children. Hence, it is prudent to understand the challenges they face and learn strategies that one can employ to make the experience more pleasant for the child, the caregiver, and the healthcare provider. One of the barriers identified as a risk factor for poorer care of such children is inadequate training. I hope to be able to bridge that gap for you today. I will be discussing what autism spectrum disorder is about, what are the challenges such children face, and what are the factors that facilitate the healthcare encounter. The strategies that I will be discussing are to be used as a guide. I would like to highlight that the approach has to be individualized. Autism spectrum disorder is a developmental disorder of rising prevalence. It is estimated that 1 in 54 children have autism based on CDC's Autism and Developmental Disabilities Monitoring Network. It is 4 times more common in boys than girls. Children with autism experience challenges in social communication, social interaction, and may also have behavioral challenges. The challenges of interacting with a child with autism spectrum disorder in the healthcare setting include: the child may experience significant anxiety surrounding new environments and experiences. The child may also have difficulty in regulating emotions. This may manifest as extreme distress, for example, meltdowns, head banging, throwing oneself on the ground, screaming and crying and throwing objects, or even running away. The child may be overstimulated in the new environment. He or she could be walking around in the room, not following instructions to sit still. He or she may be touching dangerous objects in the room. The child may have sensory hypersensitivity to the various visual, auditory, tactile, and olfactory stimuli and hence find the setting very aversive. Difficulties with transition may manifest as extreme reluctance to enter the room. If one successfully got the child to enter the room, he or she could have another meltdown when asked to leave the room. The child may have limited understanding of the procedures and/or the instructions given, making it difficult to communicate with or calm the child down verbally. The child's poor joint attention may result in difficulty getting and sustaining the child's attention to cooperate with the task given. These behaviors can result in stress to the parents, who may also add to the stress of the healthcare professional, especially one who has no experience with such children. Facilitating factors when meeting the child in a healthcare setting can be divided into pre and during the healthcare encounter. Prior to the healthcare encounter, adequate preparation of staff include training of staff to understand what autism is about and teaching staff to be flexible in individualizing the encounter for the child. Understanding the child, including knowing the child's developmental age, preferred modes of communication, including how the child expresses pain, sensory hypersensitivities, triggers for challenging behaviors, what calms the child down, are also essential in helping one prepare for the encounter with the child. The approach has to be individualized. What works for one child with autism may not work for another. For example, if the child has not been able to successfully engage in pretend play, the common technique of tell, show, do, for example administering medicine to a doll, may not help this child. The communication style needs to be tailored to the child's abilities. This can be verbal, sign language, or with alternative and augmentative communication, such as the use of picture exchange communication system, and so on. The child may also express pain differently, for example, by screaming, crying, with words, self-injury, aggression. Many individuals with autism have comorbid mental health conditions such as anxiety and depression. It would be important to know this beforehand. The child can be prepared for the visit with the use of social stories, visual supports, for example, visual schedule, first then bought, peer role modeling via a video, etc. A child life therapist or play therapist or occupational therapist trained in interacting with a child with autism can also help to prepare the child prior to the encounter. A shorter waiting time to the appointment also reduces the pre-visit anxiety. During the healthcare encounter, facilitating factors include good collaborative communication with adequate time devoted to communication. For example, clear and concrete explanations broken down into steps, telling the child and parent what to expect, friendly attitudes of staff. Flexibility and individualized care of patients within the hospital care framework. For example, avoiding unnecessary blood pressure measurements, not changing into hospital gowns, allowing the child to wear the hospital identification bracelet on a limb of choice, allowing parents to be present. Supportive aids, especially those that are familiar to the child, for example, special interest objects, social stories, visual schedules. The child should also be allowed to bring his or her safety object. A compliant sibling can be considered as a positive role model if feasible. To mitigate sensory overload from the environment, quiet rooms for waiting or resting, dimming of lights, soft music, use of noise cancellation headphones, allowing of multiple breaks may help. Reinforcement of positive behaviors during the encounter will help the child to associate the encounter with something positive. Parents know the child best. Hence, the parent can be advised to choose a reward that is not usually available to the child and is something that the child desires and will be motivating to the child. One needs to explain clearly what the reward is and what it is for. Promises should be followed through and the reward should be given as soon as possible. A short waiting time during the visit reduces anxiety and negative behaviors during the visit. Also, appropriate timing of the visit, for example, visits earlier in the day when the child is well rested, and avoiding nap times may improve compliance. A visual schedule is a series of pictures that represent the sequence of activities for the child. This breaks down the task into a series of small manageable steps. It uses the child's visual strengths to help the child understand what is expected and reduces anxiety. A first then board is visual support to help the child understand the order of activities expected. Social stories were created by Carol Gray in 1991. She was a teacher from Michigan who taught children with autism. Social stories are stories that explain a social situation with details on what to expect and why, and also outline the appropriate responses. They can be used to help a person understand what to do in new situations and to cope with changes in routines. This is an example of a social story from Autism Speaks to help prepare a child when going to the doctor. The parent can edit the content of the story to make it more relevant to the child. However, one should not make the story overly specific, lest the child reject the encounter if it differs from that in the social story. Before we end the video, let's recap. Children with Autism Spectrum Disorder have an increased all-cause hospital contact compared to neurotypicals. They have specific challenges due to their underlying condition. Specific strategies are more likely to work in such children. It is important to remember that every individual with autism is different, hence the approach has to be individualized.